In snoring, your throat tissues vibrate as you breathe, causing a hoarse or harsh sound. Snoring is common, many people snore now and then, but some people snore frequently. Snoring may also indicate a serious health issue. In addition, snoring can disturb your partner's sleep. Snoring can be reduced by losing weight, avoiding alcohol close to bedtime, or sleeping on your side. There are also medical devices and surgeries available that may reduce disruptive snoring. However, they aren't suitable or necessary for everyone. There is a connection between snoring and obstructive sleep apnea, OSA. Not all snorers have OSA, but if any of the following symptoms are present, a physician may recommend further evaluation for OSA. A sleeper was seen pause in breathing. Sleepiness during the day. Concentration problems. Headaches in the morning. A sore throat upon waking. Sleepless nights. Nighttime gasping or choking. Blood pressure is high. Nighttime chest pains. Your loud snoring disturbs your partner's sleep. Poor attention span, behavioral issues, or poor academic performance in children. It is common for people with OSA to snore loudly followed by periods of silence when their breathing stops or nearly stops. Eventually, this may cause you to wake up with a loud snort or gasp. As a result of disrupted sleep, you may sleep lightly. This pattern of breathing pauses may be repeated throughout the night. At least 5 times during every hour of sleep, people with obstructive sleep apnea experience slow breathing or stop breathing. Your snoring may be caused by obstructive sleep apnea, OSA, if you experience any of these symptoms. Having enlarged tonsils, as well as nose and throat problems, can contribute to snoring in children. Obesity can narrow a child's airway, resulting in OSA. A variety of factors can contribute to snoring, including the anatomy of your mouth and sinuses, alcohol consumption, allergies, a cold, and your weight. The tissues in your throat relax enough that they partially block your airway when you doze off and progress from light to deep sleep. As your airway narrows, the force of the airflow increases, increasing tissue vibration and causing you to snore louder. Snoring can be caused by the following conditions that affect the airway. It is important to understand your mouth anatomy. A low, thick soft palate can narrow your airway. People who are overweight may have extra tissues in their throats that can narrow their airways. Airflow can also be obstructed and vibrations can increase if the triangular piece of tissue hanging from the soft palate, uvula, is elongated. Consumption of too much alcohol before bedtime can also cause snoring because alcohol relaxes throat muscles and lowers your natural defenses against airway obstructions. Snoring may be caused by chronic nasal congestion or a deviated nasal septum, crooked partition between your nostrils. Depriving yourself of sleep can cause throat relaxation to progress further. As gravity narrows the airway, snoring is typically most frequent and loudest when sleeping on the back. Snoring may be caused by the following factors. Sleep apnea and snoring are more common in men. Obesity and overweight are associated with snoring and obstructive sleep apnea. A narrow airway. Some people may snore because of a long soft palate, or large tonsils or adenoids. Snoring is more likely to occur if you drink alcohol. Alcohol relaxes your throat muscles, which increases the likelihood of snoring. Snoring is more likely to occur if you have a structural defect in your airway, such as a deviated septum, or if your nose is chronically congested. Family history of snoring or obstructive sleep apnea. Heredity is a potential risk factor. Besides disturbing your bed partner's sleep, snoring associated with OSA may put you at risk for other complications, such as sleepiness during the day, anger or frustration that is frequent, concentration problems, high blood pressure, heart conditions, and stroke are more likely to occur. Children with OSA are more likely to suffer from behavioral problems, such as aggression or learning difficulties. Motor vehicle accidents are more likely to occur when you don't get enough sleep.